Welcome to tonight's discussion with Dr. Paula Johnson, the current president of Wellesley College, on gender biology and women's health, a personal career path, breaking barriers, and her experiences in balancing work and life. I'm Dorothy Teagarden, the director of the Women's Global Health Institute.
And I'm Ulrike Deiderk, the associate director of the Institute. Good evening.
And the Institute serves as a nexus of interdisciplinary research to create partnerships, promote research, and to promote the health of women globally, with a focus on research on prevention and early detection. So thank you for joining us tonight. We're really looking forward to this interview with Dr. Plaut and Dr. Johnson. We also would like to thank the co-sponsors for this event, the Purdue Institute of Inflammation, Immunology, and Infectious Disease, Advanced Purdue and the Center for Faculty Success, the Susan Bulkley Butler Center for Leadership Excellence, and the Provost's Office for Diversity, Inclusion, and Belonging. If you have questions for Dr. Johnson, please enter them in the Q&A box at any time, and we will cover as many as possible at the end of the interview. So I'm really pleased to introduce tonight the interviewer for tonight's discussion, Dr. Karen Plaut. Dr. Karen, who is the Executive Vice President of Research at Purdue. She joined Purdue in 2010 as Associate Dean for Research for the College of Agriculture and later became Dean. She is a researcher at heart, and prior to Purdue, earned her PhD in animal science from Cornell University, completed a postdoctoral fellowship at NCI, actually, and had a faculty position at the University of Vermont, including later as chair of animal science at both Vermont and Michigan State. Dr. Plaut was also the lead scientist at NASA for the International Space Station Biological Research Projects, and one of the space shuttle missions included her studies investigating mammary metabolism in rats. And we are so pleased to have her at Purdue leading the research efforts of the university and here to interview Dr. Johnson. So thank you, Dr. Plaut, for agreeing to serve as the interviewer and to introduce Dr. Johnson.
Thank you so much, Dorothy. I really appreciate it. It's great to be here today and great to introduce our speaker today and then spend some time with her in a Q&A format because Dr. Johnson is so experienced and just a real inspiration. She's a pioneer who brings decades of experience in the field of academic medicine, public health, and higher ed. She joined Wellesley in 2016, placed the college really at the forefront of STEM education for women, and has also led the college's creation of a new strategic plan, which includes inclusive excellence at the heart of the Wellesley experience. She's had a number of different leadership roles. She is a physician scientist. She most recently served as the Grace A. Young Family Professor of Medicine and Women's Health at Harvard Medical School and as a professor of epidemiology at the Harvard T.H. Chan School of Health. In addition, she founded the Connors Center for Women's Health and Gender Biology at Brigham and Women's Hospital. She is a member of the National Academy of Medicine and the American Academy of Arts and Sciences. She's received several honorary degrees for her contributions to science, medicine, and public health. She was originally born in Brooklyn, New York, and attended Harvard. She got all three of her degrees at Harvard and trained in internal medicine and cardiovascular medicine at Brigham and Women's, which is one of the leading Harvard teaching hospitals. She served on several national and international boards and currently serves on the board of directors for Rockefeller University, Isabella Stewart Gardner Museum in Boston, and Johnson & Johnson. So I feel very, very lucky to have this chance to interview Dr. Johnson. She really has made an impact, and she's a true inspiration. And with that, I went through Dr. Johnson, sort of your formal bio, and I was wondering if you can tell us just a little bit about yourself and your journey through academia in your words.
Well, first of all, I just want to say thank you, Dr. Plaut. It's really wonderful to be here with you and to be part of this event. And, you know, just congratulations on everything that the Institute has accomplished and the work that it's committed to, which I think is a very important model for how we think about and execute work in women's health. So again, it's a pleasure to be here. So really through, let me just start early on. You had mentioned that I'm from Brooklyn, New York. I was first generation to graduate from college in my family. And I think that, experiences early in my life were not wide in terms of exposure, but I did have a grandmother who was quite ill with psychiatric disease that really, looking back, probably did impact how I thought about my own life and career. And when I looked back and thought about the fact that she had been misdiagnosed, and there were a number of issues, which actually fast forward to today are still issues, that there's a very clear through line. And then heading to college, I would say one of the courses, I was a biology major, but one of the courses that was extremely impactful in my life was a course given by the first woman to be tenured in the biology department, Ruth Hubbard, who was an amazing scientist. But by the time that I took her seminar, Biology and Women's Issues, she had decided to move away from basic science and really moved to really the study of women in science and the way that science was done. And this really opened up a world to me that had been unfamiliar and in many ways just it was totally new. And it was a small seminar, probably about 15 people. We all got to know each other. And interestingly, when Ruth passed away not that long ago, I spoke at her memorial service. And when I walked in the room, there were so many of us who not only were in my course, but who had taken that course over the years, who were doing work in one way or another in the field. I mean, the power of one person to change a life and to change a field and a trajectory is pretty powerful. And I know we can talk about that a little bit later. But anyway, I went on to go on to medical school and trained in cardiology, but always had a very deep interest in public health, had gotten a degree there, and wanted to figure out how would I put those together. And the ways that I did that was to become a clinical epidemiologist. So how do you actually learn, collect, and understand patterns of care using robust data to really impact the course of care and change the course of care. And that was in the early 90s. And I was very interested in thinking about the intersection of gender and race, and really worked with mentors, Lee Goldman, who was one of the early founders of the field, and Tom Lee, people who really were very influential. And then went on to train, as I said, in cardiology and started my academic career, which then led me, I started in a very traditional, what we call 80-20, 80% research, 20% clinical role, and pursued my first grants. But that culminated in my being given the opportunity to start a large center, to grow a center. It wasn't large when I started. We started from the ground up, focused on sex differences in health and disease and improving the health of women. So everything from basic research to application to training the next generation, and also impacting policy. So did that for about 12, almost 13 years, ran an academic division in women's health. And all of these were quite different in academia at the time, because the work really required the intersection across fields. So it was exciting work. And, fast forward to higher education. And I loved what I did, but had been, I think, exposed to other fields and people exposed to me. I led the board of our Boston Public Health Commission, which is a very large public health department. And I started to be approached about jobs in higher leadership roles in higher education. And, and I think when those opportunities come around, and I know we'll talk about some of these decision points, the question is that the right fit? What does it mean? Is it something, when you're moving from something that you've built, that you've loved, and that has had impact, to something else? What is it that would motivate you, if you're going to make that move, to really be excited about getting up every day and doing it? And for me, it was really women's education. And so at a future point, Wellesley became, I was approached about Wellesley, and you enter a search, you know that there's a small chance of you getting the job. And we can talk a little bit about that at some point this evening as well. And here I am. And it's really been this is my 8th year. It's really been a wonderful journey. It's been a tumultuous journey. I took the leadership role here on July 1st, 2016. And we had, in November, over 3,000 alumni in our athletic center with every news outlet, to celebrate the first president of the United States would be a woman, and our alumna rising to that role. We all know that did not happen, but I would say that we were already trending towards polarization. But what has happened in this last 7 years, we've had to lead through a lot of chaos and really reaffirm the mission and try to and not try, but move forward. So that's how I got to where I am today.
That's a tremendous story. And, I could do the general parts of your bio, but the parts that you covered were much more interesting, and really interesting to see how those early pioneers impacted what you do. And your role as a physician scientist, and the importance you placed on sex differences in cardiology and in healthcare in general. And as you look forward in your research part, and then later we'll talk about some of those other roles, how do you see us getting better at what changes do we need so that we can really start understanding some of those differences at a deeper level? So what do you see in the field, coming in the field in the future?
Well, I think we're living at this very interesting moment where, let me just kind of set the stage, because I do think we have a real opportunity right at this moment to advance the study of sex and gender differences across health and disease. The White House has just announced a new major initiative that will be led by Jill Biden. The NIH has commissioned a study that the National Academy of Medicine is doing on what are the major gaps in women's health. And the National Academy just spent its entire annual meeting, the scientific program, focused on women's health. So I think those are really important.
Mm-hmm.
This is an important moment for us, where it's recognized the work to be done, and it's being recognized in some very traditional institutions. And therefore, the opportunity now to really bring resources to bear and make change, I think, is at least in the past 20 years, somewhat unprecedented. So, I think that I gave the keynote at the National Academy of Medicine annual meeting this year, and I really talked about what is our bold agenda moving forward, and that, stronger research is part and parcel. That is number one. And what do we mean, by that? It was only in 1993 that the NIH Revitalization Act was passed, which mandated the inclusion of women and minorities in NIH trials. Now, it was clinical trials, not in the more basic research. And so 1993, fast forward, we have made progress, but that progress has been slow. And based on some of the work that my group did in partnership with the Kaiser Family Foundation and what was the Jacobs Institute, we really got some political capital on board. Elizabeth Warren worked to get a large study done by OMB the Office of Management and Budget, which then led to us recognizing that the NIH had not fully lived up to the intended law, that what the law really meant in 1993, which led immediately to a change in the policy at NIH to make sex a biologic variable. And what that means is really including it not just in clinical work, research in terms of men and women, but also in basic research in terms of cells, really under an animal research. So we've made that commitment in 2000. That happened in 2000, early 2017. But we know that there is still an enormous amount to go. And we even know that scientists, about a third of scientists didn't believe at that time, 2017, did not believe that sex was important as a biologic variable. So we have the policies, they must be implemented, and we have to find a way to ensure that the policies not only are followed, but we're making the most out of every dollar that is invested in research. And so this is true not only for the NIH, but it's true for industry-sponsored research. Obviously, the FDA has similar policies now, but it is very a very important piece of work. The other thing that I think is important as we think about research is in women's health, we've tended to take things disease by disease, which is thinking about, first it's breast cancer, then it's heart disease, and there's a little bit of vying for attention and funding. And I think similar to cancer, we do need to begin to think about the underlying mechanisms of disease and how sex influences them, and move to a different mindset as well. So, the strong research is critical, and then thinking about how that research is translated to clinical care is essential. Some of the gaps that we see in care today, just those that are purely focused on women, such as maternal mortality, require an all-out assault on kind of what underlies is. And part of that is biologic in terms of how we think about the risk factors for certain groups of women. And part of it is the care and biases in care and not believing women. And then as we think about policy, there's clear opportunity there. And then just the whole ecosystem of how we think about, care, research, care, training, so that next generation is actually doing the research in a particular way. That really advances women's health. So a lot to do, but I think that this is the moment.
Yeah, you've hit on so many things that resonate with me, but I thought I'd just take a minute to give you 2 examples. So I'm a lactation biologist, as Dorothy mentioned, and I had done a study, and it was in rats with their mammary glands. And when I went to publish it, one of the critiques came back and said, the data on the male rat, remember I'm studying the mammary gland, showed something different. How do I justify my work on the female to the male? And I didn't know what to say, because I'm like, I'm using the right model here. I thought you'd appreciate that.
Funny. That's a great story.
Yeah.
Did the paper get published?
Eventually it did. I forgot exactly how I said. I think part of it, I said, look this is the real deal.
That's great.
Female,
that's great.
So it goes to what happens in basic biology. The other thing that obviously resonates with me is being a lactation biologist and hearing the times that women, especially women who are giving birth, are not believed, and the numbers of cases of neonatal care that could have been resolved had they believed what the women said and really taken care of the woman at that time is just amazing to me. I mean, there's unbelievable stories about that, how women are not believed in the healthcare system. As you have done your research and look forward, can you share some of the key insights or findings that you think have been groundbreaking over the last few years or over the time of your career?
Maybe one of the places to begin is just the fact that recognition that biologically men and women are different. I think that was foundational to the work, right? And that, I think, if you go back to that, I think it was the 2000 Institute of Medicine report that coined the term. Every cell has a sex. And I think that was a pretty groundbreaking recognition, because it then sets the stage that it isn't just thinking about presentation or outcomes, but it really is the call to action to understand the basic biology across organ systems between women and men. So I think that was really groundbreaking. And then, I think in terms of our work, really focusing on that intersection of sex, gender, race, and ethnicity, and really understanding the intersections of where those factors influence the course of disease and outcomes. And I think so often we tend to think in silos, right? But it's so critical that we think about those intersecting identities, because the answers you get are quite different, and they are not or may not be exactly what you predict. So, I've started when in the early 90s, when in cardiology, the big studies, none of the big randomized trials included women. The big randomized trials on bypass surgery didn't include women.
Right.
The big cohort studies did. So, you had the Framingham study, which was really a groundbreaking study that laid the foundation for us to understand some of the epidemiology of cardiovascular disease in women. The Nurses' Health Study, obviously. But that combined with, as you think about the Physicians' Health Study, which was a randomized trial that only included men, that was groundbreaking in another way. It was groundbreaking, yes, because we learned that aspirin was preventative with regard to heart attacks in men. But it was even more groundbreaking because that was the study that led the women in Congress at the time, and that was the year of the woman, and it was really led by women across the aisle. Olympia Snow, Pat Schroeder, Barbara Mikulski, who woke up at that moment and said, gee, this study is getting all this attention. And then they realized it was only in men. And, we now know that the outcomes are quite different in women. But it took about a good 20 years for us to know that. But I would say, some studies are groundbreaking, not just because of the science, but because of what they catalyze. And I would say that was a transformative moment.
Yeah, I think that's really a great example. And it's amazing how you mentioned before that 2017, and still people don't understand that there are these gender and ethnicity differences that are really important in studying these diseases. I'd like to turn a little bit to your role in the field, and just you're such a role model for so many people, and we know it didn't happen by accident, but we also know there are challenges along the way, and just wanted to get an idea, what were some of the challenges that you faced, and what kind of strategies that you used to overcome them?
Yeah. I think that that's a lot. That's a lot to unpack, I know, in a single question. But I think that when you are one of few, or maybe the only one, I do think that there is a certain amount of pressure that does create. And so, some of the challenges there are to ensure that you remain focused and steadfast in what at least your shorter term goals are. But how do you also maintain a sense of self and your own identity? And how do you also, if you don't have a lot of other people around you, just find the courage and the strength to move forward? And I do think that those are those are actually important things for us to address. Now, what I would say is role models are critical. And I'll tell you a story. When I was early in starting my academic career, my chief at the time, this was after I was finishing my chief residency, he would have talks with the chief residents and suggested that the field that I was going into might not serve me well, mainly because it might be viewed as self-serving to study women and people of color at the intersection of the two. And he was, look, this man, I mean, he was a giant. He is a giant in medicine, and I had the utmost respect for him. I had already made a decision, and, I'm sitting there in front of him. And I think that, I decided that I kind of tucked that away, but moved forward and felt that this was the right move for me. And I think that, at that moment, had I let self-doubt be the driver, I might have made a different decision, or might have become so worried about the decision that it might have become a bit more paralyzing. And fortunately, I did not do that. Now, why? I think I had other strong mentors who did believe in me, and had, my husband at the time who believed in me. And I think I had enough kind of sense of self to move forward. And I think that those are important things for us to really consider when we face challenges, and we all face them. That was one. I can tell you there are many more. But I think that those are really important as we kind of move forward, even in times of, where there might be some forces that might not think that is the right direction. And, for me, choosing women's health, I mean, I chose to go into fields in which the traditional academic medical setting is not set up to necessarily support.
Right.
The work you do, the work that happens at the Institute for Global Women's Health. How do you do this interdisciplinary work in a sustainable, powerful way when departments are quite siloed? So I think that those are challenges, and you need support and institutional leadership, but you need the skill set to move those forward. By the way, let me finish the story of the original story about my chief of medicine, who I am very good friend, we're friends, had always remained in touch with him. As I said, he is brilliant and just a phenomenal mentor in medicine writ large. And about 20 years later, when we were meeting, he actually looked at me and he said, I remember what I said back then, and that it was a mistake. And to me, that was a very powerful lesson, because here was a giant in medicine. He was acknowledging that it was a mistake and had remembered. And the lesson also is that people are not unidimensional. I didn't agree with what he said, but it doesn't make him a bad person not to be engaged in my life and career. And we were able to find those spaces. And, what a gift to me. And I just saw him actually a couple of months ago at a dinner at the house where we had a number of my former mentors, which was just wonderful. But being a role model and a mentor is so critically important.
That's a wonderful story. And I think the other thing that I would just like to mention that I hear in your story is resilience.
Yeah.
As women, we both have faced adversity at various times where people say, no, that isn't how you need to move forward in a way that isn't easy. And having that resilience to say, no, I'm going to stand behind what I believe in and I'm going to move forward is really, really important. And I just bring that up because I think it's so important for women to realize just because one person says one thing doesn't mean that's what you need to do. You went to other mentors, you looked within yourself of what you needed and said, no, I'm not going to listen to that advice. I think that's very hard for people. So I so admire the way you thought about that issue and brought to light what you thought was best for you. So I just wanted to point that out. It's really quite amazing. You're also the first Black president of Wellesley. Yep. And you were also the first African-American woman to move through the academic ranks to full professor. Those are both.
Well, it was the first African-American, period, at the Brigham to become in their 100 years.
Okay, period. Even bigger. Those are amazing accomplishments. And just how do you do it? How do you keep that drive to keep on being the best of the best? Yeah. And what barriers did you need to knock down to get that done?
Yeah. It's interesting. I don't think as I've moved through my career, I've actively thought about breaking barriers. What I've thought about is doing the most meaningful work, having the best people around me, and understanding kind of what that vision is moving forward, and then really working towards that vision with others. And I would say that's been important from the earliest points in my career in academic medicine when, one of the transformative programs that I was engaged in, it's now called the Harold Amos program in faculty development program at Robert Wood Johnson. And, I had already had a faculty, an early career award grant. And this was something that I knew it would surround me with senior leaders who would be mentors, as well as with peers who look like me, right? People of color who were all entering science and in academic medicine. And the question was, well, you already have a grant, but I knew that something like this could be a game changer, and it was. And I think from the earliest point, understanding who are the people around you who you can work with, consult with, but then also when you're in positions of power and authority, hire, and who are those that you can also open the door to, who all really end up moving in a direction. They're not all going to stay with you because they all go off to do different things. But I have found that to be some of the most powerful, motivating work for me, from kind of the early stages all the way up through my time here at Wellesley. And it is that joy that I've gotten out of not only achieving what we achieve, whether it be in science or clinical care, in what it means to populations of women, but also that joy out of mentoring other people, pulling a team together that can achieve heights that we never imagined. So it's that balance between doing that hard work that, quite frankly, day in and day out, sometimes, they're difficult experiences. So when you talk about resilience, to me, it's thinking about the other side of what it is that has the impact. And, I go back again to Ruth Hubbard. The lives she touched over those years have ripple effects of impacting, I don't know how many young people and how many fields. And I know in no way would hold myself to that standard, but that is a really powerful thought that does keep you going in terms of having a meaningful life and doing really meaningful work. And I've had the opportunity and fortunate, opportunity to do it in 2 fields.
Yeah, that's fantastic. And, our next question is about what qualities and skills are essential for successful leadership. I mean, part of that, I can just hear it in you. And first of all, in the way you've mentored other people and the way you think about the whole structure, you've already given me some qualities and skills that surely have made you so successful. But if I have to ask you that question, and I feel in some ways like I don't, because I think you helped me think that through. But, how would you describe some of those skills that you think are, have really gotten you to where you are today? And that really in your leadership role, just before we got on, you were talking about the difficult times right now around the country and the polarizations and things like that. What skills do you rely on to help in your leadership and in those difficult times?
Yeah. I do think leading with empathy and care and ultimately integrity is, I think those are central. And I do think the empathy piece and the integrity piece are just so critically important because we face difficult decisions. And in order to really get the best information, right? Obviously, we're going to lead using evidence, but what is evidence and whose evidence? And how do you understand the people that you are leading? And that requires a deep curiosity and caring about who they are. And I think that in addition to all the skills and the things that, of course, we have to have, I would say that those are critically important in order to execute any kind of major initiatives to get to a vision, right? To live out whatever the mission is in order to achieve a vision. Those skills are just so central. And I think about the time that we're living through right now, which is a very tumultuous time with a lot of finger pointing, a lot of yelling and screaming across each other. And how do we understand each point of view, the different sides, the points of view? How do we listen deeply beyond the anger to really hear the stories of people? And it then helps to inform kind of the actions you take, the way you lead. So, there are all the cliche things about being able to develop a vision and all of those things. To me, that's without saying, but it's the other pieces that are critical in whatever it is you do. And I always kind of lead with thinking about the institution that you're working at or developing. The one goal is to lead with the thought that you're going to leave the institution better than when you found it. And I don't mean that it was not great, because it was great. But what is it that your leadership with others did to kind of continue on a path, or to do that? And that's also, I think, a measure of kind of the quality of leadership.
I think that's wonderful. I mean, that's just so true. And I love the things you outlined is so important. Um, Now let's turn to a little bit of a different topic, which is work-life balance and how you balance your personal life with your career goals. I know that's often a challenge. And do you have any secrets you can reveal for the rest of us?
No, I don't have any secrets. And I rarely call it work-life balance. I call it work-life integration.
Yep.
Because I don't think there is necessarily a balance,
Mm.
and that balance, whatever it is, changes during
Yep.
different times in your life. You know, I would say that there's no one answer that's right for everybody, right? What it is that we have to do is figure out what is best for each of us at any given time during our lives. And that may mean different trade-offs that you make, that both serve your family well and also serve your career well. And I do think that that those are possible. I do think, though, a person like Claudia Golden, who just won the Nobel Prize for her work on career, kind of women and work, career and women, that we have a lot of responsibility as leaders when you reach a point when you can lead and make decisions to make sure that you are thinking in your environment, what are the ways that you can improve upon the ability for women to integrate work and life, right? Because that is, we never want it to be for this next generation what it was for us. We're not trying to recreate that. Just because I figured out how to struggle between whatever the issues are. You know, when I had my first child, we did not have maternity leave.
Wow.
So I had to keep my grants running, and I came back. You know, you kind of slipped out and you came back, and that was there wasn't a true policy. You know, we wouldn't think of that today, and nor should we. So really thinking about what our responsibilities are is so important when we are in leadership roles, to make sure that we can get the work done that needs to be done. And sometimes it is hard, and sometimes the hours are long, but to not make, as Claudia Golden said, not make it always the greedy job that ends up driving women out. With that being said, I do have to say a few things. I do find young women frequently need the support to understand that being a good mother does not always mean doing some of the major kind of traditional things that many women do. Not that that's bad, but if you don't do them, it does not mean you're a bad mother. It needs to be a choice that you need to make. And I was really earlier, you know, when I was in academic medicine, I would really, in my annual reviews, talk with young women about this. And it was very helpful because it was important that they could see someone in my role also have a family, have had some struggles and illness in family that I don't hide, but be able to have a space and place with someone who is your division chief or center director, be able to talk with you about that as an integral part of your work, right? Your work doesn't stop when you leave the hospital. Your work is the entirety of your life. So that was always a policy of mine. And I still think, and I would say I lead today in that same way. And again, that integration and understanding that balance that you have to strike at any given time is going to change. So if you're facing a family crisis, yes, you're going to need to step back, and that's okay.
Yeah.
because you can step back and step back in.
Yeah.
But just kind of making it so that that is something that people feel they can do and should do.
Yeah, I think that's a great point. And I think it goes for men and women too in
Yes.
today's world, trying to give men more space when they need to step back. One of my questions to you is, when you look at Wellesley, are there some policy changes that you've made during your time there that you think have really helped women move forward and has made the environment more enriching for women?
So, we're a women's college. So you have to
Right.
remember, I'm walking into an environment that is already different.
Right. Very different.
Our faculty are 52% women.
Yeah.
And that's across disciplines.
Yeah.
And we are a women's school. But I think there's a lesson in that, which is what you see influences what you believe you can do.
Yeah.
And we shouldn't take that for granted at a women's college, which means that we have to keep our eye on very strongly on diversity amongst our faculty and all types of diversity. Wellesley, so what's changed around our hiring, we have some of the most outstanding faculty that we work very hard to retain. But with that, we're ranked number 4 with regard to diversity of our faculty. So, that intersection now between gender and race, ethnicity is very powerful. And that serves a very diverse student population, which now, we've doubled in the past, almost 10 years, we've doubled the number of underrepresented successful STEM concentrators. 44% of our students major in STEM, many double majors in the humanities, 33% humanities, 38% social sciences. Number 1, major is economics with, we have really populated the field of economics. But I say that because with an increasing diversity of students, they need to see people who look like them. And there is a way that we have also begun to really transform the institution to be far more welcoming and supportive of the diversity of students, whether it be socioeconomic diversity. Our first year class is 24% first generation, 60% on financial aid, with a grant of $63,000 on average. So if you look at that population, that's different than it was 25 years ago. Yeah. So what does the institution have to be to ensure the success of this marvelously diverse group of students and faculty? And I think that's the environment that we have really invested in. And it looks different than when I came. And I'm pretty proud of that work that the faculty and the staff have all partnered and led.
That's a fantastic achievement. And, those kind of achievements, it gets back to something you said before about leadership that lasts well into the future. You've changed the culture, if I understand you correctly, of the institution to be much more welcoming to this diverse population. That really is a fantastic achievement. And I just love to hear it because you're going to it makes a difference for the future.
But we have more work to do. I mean, we really have more work to do.
Sure.
And, so we don't take it lightly. It's always striving to be better.
That's right. One last question I'm going to ask, and then I'm going to open it up, I think, to the audience for some questions, or our co-hosts will do that. What piece of advice would you give to women or women of color that are entering academia? Do you have a couple words of wisdom? You gave so much wisdom already that I kind of feel embarrassed asking the question, but we always like to see if there's, something in particular that you want to focus on.
I've talked a lot about who needs to be around you. I've talked a lot about, what good mentoring really means, staying focused, not really being deterred, but being open to input. But there's one thing that I think about if I look back on my career that was extremely helpful. And I think sometimes you're told not to engage as actively in the world around you beyond the academy. And while I think in the very early stages, you really do have to focus on your science or whatever, or on your clinical work, whatever it is your area of focus is. But I also think that there is a power of being engaged as a person beyond the narrow academic realm. And I think it's very healthy for women, I think particularly for women of color, because of the small numbers, to really look for active engagement and even particular leadership roles. Not many, but I think about my own engagement in outside organizations that nurtured my soul in many ways, and allowed me to grow in ways that I would not have grown as quickly within the academy. And there was a tremendous synergy with those. And I look back and I think if I had asked permission or asked, what do you think? I think somebody would have said, don't do that. Focus on your work.
Right.
And that would have been very wrong for me. So I do think about who you are as a person, who you want to be, what gives you joy. Not that work doesn't give you joy, family should give you joy, but what else might give you joy as an engaged person in this world? And I would say if I were to say anything, I would say be involved to the greatest extent that you can, because it will help you grow in so many different ways.
That's some great advice. I think we're going to go to the questions now.
Yes, thank you so much. I would like to thank you both, Dr. Johnson and Dr. Plaut, for this really engaging conversation and for sharing all your insights on gender biology, women's health, and your insights to a very successful career as a female scientist and as a leader. We are now open for questions from the audience. I wanted to remind everybody again that you can just type in your questions for either Dr. Johnson or Dr. Plaut into the Q&A box. We will be reading them out loud. And please note, we have already gotten quite a few, so we will try to get as many as possible in the few minutes that we have left. So I would like to start with one question that states that the attendee was very excited to hear that Ruth Hubbard was one of your mentors, Dr. Johnson, and that she wrote an important article about disability, selective abortion. And through your contact with her, did you become at all involved in disability bioethics or disability studies in biology or medicine? You've touched a lot on diversity. How does disability play into that?
Yeah. Disability absolutely plays into that. And I would say that in academic medicine, as we studied women and really thinking about the different experiences of women, looking at disability, now talking about physical disability in particular, is something that has not been studied well enough. One of my colleagues who I went to medical school with, who we still stay in touch, Lisa Iazzoni, has been really such a major leader in this area. And she's helped me to open my eyes to some of the areas that have historically been left out. I would say where I've done more learning and work on disability has been actually as a president of Wellesley College. And really understanding that when I talk about inclusion, that disability must be articulated, because when it's not, it actually is left out, and that there are many ways and policies that we've implemented and looked at in terms of all types of disability, that I think we have a different lens on it today than I did, at least when I came to the college. So it's been quite an education, and some of it has been led by students. And I've learned a lot directly from our students, and it's made us a much better institution.
Wonderful.
So I'm going to ask you the next question on here. But before I do, I did want to say you brought tears to my eyes when you started talking about your mentor, because it makes me think of my mentors and how much they influenced me to come out of my silo, but also that I could be the person that I wanted to be, and still be a successful academic. It took me a while to learn that, and it was so important. So thank you very much for those insights. So the question here is, could you explain more for those of us outside the sciences what it means that every cell has a sex? What does that look like at the cellular level?
Absolutely.
Which is one close to my heart too.
Yeah, no, it's a great question, which is that so the 23rd pair of chromosomes for men and women are different. Women have two X chromosomes, and men have an X and a Y. And that's foundationally and that is who we are at the foundational level of every single cell. So every single cell, in a way, has a sex because of that difference. Now, what's really fascinating is that, why am I just blanking on his name? Anyway, there's a scientist at the Whitehead. David, I'm just blanking on his name for a moment, but really an outstanding scientist. And he is doing some amazing work looking at the X and Y chromosomes and really breaking down old myths about how they came to be and how they influence health and disease. So it's still a moving target, still a lot of work to be done that is just fascinating. But that's what I mean by every cell has a sex.
Wonderful. I have another question here for you that asks, do you think that preventive medicine affects men and women differently, or men and women's health differently? And it was jumping. Yeah. What are the main gaps in this area, in your opinion, in preventative medicine?
Yeah, no, it does. But I think if you think about it, so we know from kind of epidemiology that so that's the study of kind of large numbers as we look at disease and risk factors. We know from those data that, I'll just take cardiovascular disease, so heart disease. We know that some of the risk factors differ in women. For example, in women who have the cardiometabolic disorders of pregnancy, gestational diabetes, hypertension of pregnancy, preeclampsia, we know that those women are twice as likely to develop cardiovascular disease as they age. We also know that their children are at higher risk. So that's a very obviously sex-dependent risk factor. And by the way, some of the work there around recognizing the risks for preeclampsia, there's some really exciting new work there by another colleague, a former colleague of mine, Ravi Tadani, that we can actually now look at markers, which is pretty amazing. But just some of the other risk factors, some of the ways that we look at lipids, so cholesterol, HDL has more of an impact in women than in men. So the traditional cutoff should be higher for women. Women do better with an HDL of 50 or more. And what we now have is kind of an average recommendation for men and women, which really isn't correct. But those are just, there are other ways that we can think about some of the risk factors that we know about from epidemiology. What we don't fully understand, and this is really across diseases, across organ systems, is why. Why do you see differences in risks? I could go on to lung cancer, where You're seeing higher rates of lung cancer in young women. Now, different types of lung cancer than smokers, so non-smoking young women. But why are we seeing these rates? We know that we're seeing it, but we know from epidemiology some of the risks, but what is that underlying biology? So we know some of the risks that are different. What we don't fully understand is why do we see those differences and what's driving them? So that's a lot of the work we have to do.
I am afraid to say that we're going to have to end at this point, since we're at time. And it's too bad because there's some great questions yet to be asked. But thank you again very much, Dr. Plaut, and a special thanks to you, Dr. Johnson, for this really inspiring discussion.
It's a pleasure.
So everybody, please join me in thanking them with a virtual applause. So please visit the Women's Global Health Institute website for the video link to this recording of this interview, which will be up soon, and to learn more about our upcoming events. And if you enjoy events like this one tonight, consider donating to the WGHI through our website or click on our gift link. But again, thank you so much, Dr. Johnson, for your interview tonight, and Dr. Plaut.
It was my pleasure. It's wonderful. Wonderful to be with all of you. And thank you, Dr. Plaut, for a great interview.
Thank you. It was so much fun and so inspiring.
Thank you all again. Yes.
Good night, all.
Good night.
Night.